Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, founder of Migraine Nation and chronic daily migraine survivor. I am super excited to tell you that I am here with Dr. Melissa Geraghty. Hello, Dr. Garrity. How are you today?
Hello. Thank you for having me. I'm doing good. How about yourself?
I'm great. So we have Dr. Garrity on quite often. We love her. You love her. So let's chat with her. Dr. Garrity is a clinical health psychologist and the CEO of Phoenix Rising with Dr. G. She's very popular in the migraine community. Our topic today is what we should be thinking about when we are stuck in bed or on the couch with a very severe migraine. You know, I like to call them bedridden migraines. I generally don't give them a number on the pain scale because we have so many other symptoms, right, than pain. So I wanted to discuss this topic because in my 40 years of dealing with migraine, I feel like it's pretty much the job of migraine to take our mind and our mood and just take it down a rabbit hole. That's what it wants to do. And so we need to find creative ways to not let that happen. And so I thought Dr. Garrity was a good person to talk to us about how to keep our mentality up when the pain is just, trying to do everything it can to ruin our minds. So, Dr. Garrity, before we get started, I've already divulged that, I've had migraine since I was 4. You also have a migraine history. You also have a chronic health history. If you would like to talk a little bit about that so people know that you're coming from a place where you understand them.
Absolutely. Yes. I have well over 30 complex medical diagnoses, including the rare disease tethered cord syndrome. So I had neurosurgery on my spinal cord in October 2019, followed by a CSF leak surgical repair 10 days after that. So all the CSF leak related headache symptoms are horrific. I also have chronic migraine and cluster headaches, as well as other headache and migraine diseases.
Yes. So Dr. Garrity, not only as a clinical health psychologist, she understands where we're coming from personally and medically. Being unhappy is a normal response to pain. We don't like it. But what everyone may not be aware of, and I know when I was younger, I was absolutely not aware of this, is that our mood and our thoughts are completely tied in our brains to the process of pain chronification and to our perception of our pain. Is this correct? Can you chat a little bit about this?
Yes, absolutely. When we're having chronic pain, acute pain, or whatnot, it definitely can be tied to, having more depressive thoughts, anxiety-related thoughts. And what's important here is how could it not? This does not mean it's all in our head. This does not mean that we're making things up. My goodness, no. But what happens is when we respond with these acute pain episodes in maybe a heightened way, mentality wise, they can worsen for us, both our mental health and our physical health. And again, this is not to say that you're causing it. It's a very normal reaction. Of course, it would happen.
Right, right. So I like to make sure people know that you're not causing your pain, but this is one of the ways that we can work to help ourselves is with our minds. And so this is why we like to talk about it. So I like to say, and I did not make this up. This is in a book called Explain Pain. I think it's in that book. If you stub your toe when you're in a bad mood, it hurts worse than if you stub your toe when you're in a good mood. That's one way, example of how these things are linked in our brain. So do you have any personal tricks that you recommend to your patients for keeping our moods up when we're in pain and we're stuck in bed and we're probably stuck in a dark room, all these miserable things that we have to be, we might not even be able to watch TV because of the photophobia, right? So what are some tricks?
So for me personally, what I tell my patients, as well as when I go to speaking engagements and for myself, is not to force it. I know some people talk about sometimes a fake it till you make it, or trying to force yourself to be happy. And all of that can actually lead to some toxic positivity that
Mm-hmm.
maybe if you force yourself, it can help in the short term. But if we're in a really significant pain episode, chances are you might get more crabby, and might be more upset because you can't
Right.
just get yourself to be happy, kind of thing.
Right.
So what I like to tell people is sometimes we just need to honor the moment and be upset and be in it, but not unpack there. So what that might look like is if we could reach out to someone in the chronic pain community, our migraine community, headache community, if we can reach out to a trusted family member or friend, a therapist. If those aren't options, if we can write, if we can't write because the pain is so bad, just kind of honor in our heads of, I've gone through this before. I've
Mm-hmm.
gotten through it. This is not going to last. It may
Right.
feel like this is the worst moment ever, and this is not going to go away. But history has taught me, even in chronic cases, that pain ebbs and flows, and
Mm-hmm.
that I will be able to, move forward somehow, whatever that looks like. And so
Mm-hmm.
that's what really helps me, of just understanding that concept, that even those of us like myself who live with moderate to severe pain 24/7, that it
Mm-hmm.
still ebbs and flows within that severity.
Right. And I mean, I have a list of empowering and funny movies
Yes.
because I usually get past the photophobia enough that I can watch a movie once
Yes.
the pain is horrid. For
Yep.
whatever reason, I am more of a phonophobia person, so I just keep the volume low. And I watch something that makes me feel empowered or makes me laugh, or I might not be laughing out loud, but it's still funny. And the more you can do something like that, or if you have to use sarcasm, use it. Your
Yes.
sarcasm might seem really dark to someone that's not in
Yes.
pain, but trust me, I would get it.
Oh my,
So
yes.
yeah, and another thing, especially with kids, like my son was diagnosed as chronic when he was 7. I was chronic from the time I was 4. Color. Kids love to
Yes.
color, adults love to
Yes.
color. Such a great thing to do.
Exactly. It's shifting that focus, that while we're still in pain, that's
Mhm.
not going away in this moment, but at least we can do something that we feel we value and that we care about, even if it's difficult, even if it's coloring out of the lines because our vision is blurred.
Yeah.
Yes, absolutely.
It doesn't matter what it looks like. No one's going to judge
No,
your color. If someone judges your
exactly.
coloring when you have a migraine, you give me a call.
Yeah,
Um,
me too.
so this is an important topic because this happens. What do we do with the invasive thoughts, these negative thoughts that show up when we have a migraine? Like, oh my God, my boss thinks I'm lazy. Everyone at work thinks I'm lazy. Oh my God, I'm dying. The pain is so bad, I must be dying. These thoughts show up. What do we do? How do we turn them around? Do you have any tricks for this?
Absolutely. So of course this is person dependent, right? Because not
Mm-hmm.
every skills people are going to like. There's some people
Mm-hmm.
who like some things better than others, and that's totally fine. But something that helps me and a majority of my patients is trying to almost reframe, like, oh my goodness, I'm having all these negative thoughts. I'm negative Nancy, old saying, and just getting down and I can't think anything positive. So instead of labeling it as negative versus positive, is that a helpful thought or unhelpful thought? So if I'm sitting there, and this takes practice, if I'm
Mm-hmm.
sitting there in bed with a migraine attack and I'm thinking, oh my gosh, I had to cancel from, work again today. My boss probably thinks I'm lazy. And then it can easily snowball into, oh my goodness. And then my husband's going to think I'm lazy and I can't do
Yeah.
this and I can't do that. And then boom, boom, boom. Right. And so it's about trying to stop in that moment and take a deep breath, recognizing that this is an unhelpful thought. What can I do that would help myself out in this minute, to give yourself compassion, right? So
Mm-hmm.
it might look like coloring. It might look like getting yourself another ice pack. It doesn't have to be a grand gesture for yourself. And
Right.
then 2 seconds later, you might think, oh yeah, but my boss thinks I'm lazy. And then you do it again. That's unhelpful. Thanks, brain, for that. That's an
Right.
unhelpful thought. What can I do this moment? And so it's going to be easier at some times than others, but it's just continually reminding yourself, all right, what can I focus on in this moment? What do I have control on?
Mm-hmm. Okay. I like that. Sometimes when like these really negative thoughts show up, I know it's the pain talking, and I'll
Yeah.
almost talk back like, oh, that was creative and mean.
Yes,
You know,
totally.
like
Yes, yes,
I know that's not true, you know, like we
yes,
don't need to be thinking about that right now. We need to be focusing on getting well.
yes.
And I will almost and I didn't learn that till recently. I'll just almost talk back.
Yep.
Because I know it's the pain doing this to
Yeah.
me.
It's not you.
No,
Yeah.
right. So this is a good one and an important one. What about people who have people in their lives who are unsupportive, maybe even in their houses? If they're not in their houses, they might be in their family or their close friends. They might be on their phones while they're in bed. They're just unsupportive. They're like, okay, well, when are you going to get out of bed? Are you going to make dinner today? You had a headache yesterday. Nobody has a
Mhm.
headache every day. You know, these things that no, we do not need that in our world. How should we deal with with these people?
Yeah. Well, first off, hopefully that person will have someone like a pain psychologist to talk to about this, or people in the migraine community if they're unable to have a psychologist for,
Mm-hmm.
and there's many reasons why people can't. Um, eh, what I say to people is if you have someone, especially in your house, and you've tried educating them, and maybe they
Mm-hmm.
won't read the articles or books you've sent,
Mm-hmm.
and you continually have tried this for years, because this is what I hear a lot of people have tried and they've done everything, but the person is not interested. They just believe
Right.
it's a headache, and you should just pull yourself up by your bootstraps, right? And
Right.
so then it's like, okay, is couples counseling a thing, or counseling for the family a thing? Well, if the
Mm-hmm.
person's not willing to do that, or even go to individual counseling, like the person who doesn't understand, then people tried that. And then it can escalate to, is this a person you really want in your life?
Yeah.
And that has a whole bunch of, for the lack of a better word, because I'm getting a migraine attack, things attached to
Yeah.
it. In that, what if you can't afford to move out? What if you're married and you don't have other family members you could live with? And how do you
Right.
how do you focus on that? If you can leave and you can remove these people, that can be really empowering eventually, even though it's difficult at first, super
Right.
difficult. But if you can't and you're stuck with them, it then shifts to, how can I focus on myself, and how can I not be as reactive when they're on their train of, you're lazy, you're this, you're that. And so it is
Mm-hmm.
about, what can I do, going back to that. But it's
Right.
not easy.
No, it's not
Yeah.
easy, but I think that even just addressing it is so important. So while we're on the topic of, let's switch back to really quick. We've got these thoughts going through our head. What if we're someone that's chronic, and we just, we're starting to feel like this all the time? How do we know when we might need to go talk to someone and say, hey, maybe we need a medication or something, and we've been down for a long time? What are the signs?
Yeah. So it could be withdrawing. A person is not responding to friends, family, or community as much. It could be that they're not doing hobbies or interests that they used to
Okay.
do. It could be that maybe their hygiene isn't being taken care of. So it can be
Mhm.
really a range of things where it might be time for a person to say to themselves, okay, I understand that in the past treatments have failed me, and I haven't been wanting to go back to another doctor to try again, but maybe it is time, or maybe I need to start with a therapist or psychologist and really
Right.
be able to process this, or reach out to our community to just get that extra support.
Okay. Are there any books or resources in particular that you recommend to help people with their mentality if they have migraine?
Yes, my favorite book is The Happiness Trap by Dr. Russ Harris. It's an
Okay.
acceptance and commitment therapy type workbook, and it is phenomenal to help people through being with just life, right? And all that comes
Right.
with it. And I love how reading it, it can get adapted to chronic pain, depression, anxiety. I mean, it's all in there. So I really love that. That's my top book. I've read it
Okay.
several times, my favorite. And then also, I do like the Mindfulness Meditation for Pain Relief CDs by Dr. John Kabat-Zinn. I
Oh.
really like those as well. I find that they have some neuroscience education, and it's just very comforting. He has like a soothing, steady voice,
Mhm.
non-judgmental, very compassionate, no blaming, no judgmental, you're causing your pain. I
Mhm.
really like both of those as recommendations.
Okay, great. Thank you. Is there anything else you would like to add to this topic, the topic of being stuck in bed and keeping your mentality up, before we go today?
Yeah, just again, trying to show yourself compassion. And in those moments when that's too difficult and you don't have any energy to muster to show yourself compassion, it can
Mhm.
be helpful to show others compassion, such as
Mm.
thinking about people you care about in your life, petting animals. Because a lot of
Oh,
times when we're able to show compassion externally, we end up extending some to ourselves.
oh, that's great. All right. Well, thank you so much for being here. And
Thank
thank you,
you.
everyone, for listening into this episode of Heads Up. Please join us again next week for the weekly podcast and webcast of the National Headache Foundation.